Hello there, and a very warm welcome back. It's really great to have you joining us again. We like to think of ourselves here as part of the lively later life family. We're all about being your guide through the sometimes tricky financial landscape, helping you build a secure and, well, vibrant golden age. Our goal is always to sift through all the information out there and bring you the clearest, most useful insights. Turning complexity into confidence, you could say.
That really is the core of it. Our mission with Lively Later Life is, to link that financial peace of mind with the real promise of a thriving retirement. And well, when you think about living that truly vibrant later life, there's probably nothing more fundamental or potentially worrying for some than managing our health and the costs that come with it.
Absolutely. And that brings us straight to today's deep dive. Smart planning for healthcare costs, navigating BC's system, and saving more. Hey, it's a topic that really affects everyone, but as we get older, health naturally becomes an even bigger priority. And with that comes a whole different set of things to think about regarding expenses, costs that, if you don't really understand them or manage them, can feel pretty daunting.
Oh, definitely. It's a concern I hear all the time. We're very fortunate here in Canada, obviously, with universal healthcare. And this is the key thing, it's crucial to realize it doesn't cover absolutely everything. There are significant out-of-pocket expenses that can really pile up for seniors, and they can add up faster than you might think if you don't have a sort of proactive plan. Understanding these details, these maybe less obvious parts of the system, is really key to protecting your savings.
That really hits home. I was talking to someone just recently, actually, at a community health fair over in Richmond. Met a very kind woman, Mrs. Patel. And she was telling me about her situation. She relies on several prescription meds, like many folks do, and that's a constant expense. Sometimes it goes up. She knew about the government plans, but she was finding the costs were still significant, and the whole thing just felt like a maze. She was trying to figure out, what's covered, what isn't, are there smarter ways to save money? And I remember she looked at me and she said, quite earnestly, I just want to make sure I can afford to stay healthy without draining my savings. And that simple sentence, it just really highlighted for me how vital it is for seniors to not just know about the system, but to really understand how to use it effectively, how to manage those costs. It's about being strategic, really.
That story about Mrs. Patel, it's incredibly common. It really echoes what so many seniors are feeling. Our universal system gives us that essential safety net, yes, but it's important to see the specific areas where costs tend to fall on us personally. We're talking about, predictable things like prescription drugs, which are a regular expense for many, but also dental care that can range from routine cleanings to really expensive procedures. Then there's vision care, eye exams, glasses, contacts, mobility aids, maybe walkers, wheelchairs. And the big one potentially is long-term care down the road. The costs there can be substantial. These are all areas where your personal finances definitely play a role. So maybe you're listening and wondering, how do I prepare for unexpected medical bills? Or how can I really make the most of BC's system without, spending more than I need to? These are exactly the kinds of questions we want to tackle today.
Exactly. And for those of you listening, does Mrs. Patel's story ring a bell? Have you faced similar things or had those same worries about managing health costs? We'd genuinely love to hear from you. What's maybe one challenge you faced with healthcare costs? Or even better, have you found a clever way to save money on medical expenses? Share your smart tips. Put them in the comments below wherever you're listening. Your experiences, your wisdom, it can really help others in our community navigate this too.
And that's exactly why we're doing this deep dive today. We want to help you feel more confident, more in control of your healthcare finances. Because from our perspective, having a lively later life is so closely tied to having the best possible health. And good health is best supported by, well, smart, proactive financial planning. This conversation is meant to be your guide, looking at real, practical strategies to manage and hopefully reduce your healthcare expenses, specifically within the BC system.
Right. So think of this as our roadmap for today. We're going to start by sort of demystifying prescription drug coverage. It can be confusing. Then we'll get into understanding extended health benefits, what they cover, how they work. We'll also explore options for home care and long-term care planning. That's such a vital, forward-looking piece. And finally, we'll shine a light on various financial assistance programs available specifically for seniors here in BC. So get ready. Let's make sure your well-being is supported without adding unnecessary financial stress. Let's plan smartly for healthcare. Okay, let's get into it. Health and wealth. Smart planning for senior healthcare costs in BC. To really start managing costs effectively, we first need to have a solid grasp of the basics, the foundation of BC's healthcare landscape for seniors. setting the stage, as it were.
Exactly. That's the perfect starting point. So, the absolute core of healthcare in BC is the Medical Services Plan, or MSP. That's our provincial health insurance. It covers medically necessary services from doctors, visits to your family physician, specialists, and diagnostic services too. Things like x-rays, lab work, ultrasounds.
And the premiums, people used to pay those monthly premiums, right? But that changed.
That's right. Many of us will remember paying those MSP premiums, but importantly, for most BC residents, those premiums were eliminated back in 2020. That was a big change, definitely reduced a monthly cost for a lot of households.
So just because the premiums are gone doesn't mean you don't need to think about MSP.
Precisely. Even without premiums, you absolutely must be enrolled in MSP to get coverage. This isn't automatic. You still need to actively enroll. If you're new to BC, or maybe returning after being away, you have to apply. You can usually do it online, by mail, or at a Service BC center. You'll need to prove you live here, and there's usually a waiting period, typically the rest of the month you arrive, plus 2 full months. So definitely plan ahead if you're moving. Without being enrolled, every doctor visit, every test, it's all out of pocket, and that can get very expensive very quickly. So yes, premiums are gone, but enrollment is still absolutely vital. It's your main door to core medical care.
Okay, so MSP covers doctors and basic tests. But then we get to prescriptions. That's often a big ongoing cost, like Mrs. Patel was experiencing. That's where Fair Pharmacare comes in.
Exactly right. Fair Pharmacare is the key program for managing prescription costs in BC. It's the provincial plan specifically designed to help BC residents with the cost of eligible prescription drugs. It also covers some medical devices like blood glucose test strips and certain medical supplies. Now, the critical thing to understand about Fair Pharmacare is its income-based structure.
Income-based. How does that work exactly?
It means the amount you contribute towards your drug costs depends on your income. Specifically, your deductible, that's the amount you pay yourself each year before Pharmacare starts helping, and your annual family maximum, the absolute most you'll pay out of pocket in a year for eligible costs, are directly calculated based on your net income. So the plan adjusts to your financial situation. It provides more support to those with lower incomes.
Can you give an example?
Sure. Let's say you're a single senior with a lower net income, maybe under about $15,000. Your Fair Pharmacare deductible could actually be zero. That means the plan starts covering a portion of your eligible drug costs right away. If your income is a bit higher, say between $15,000 and $30,000, you'll have a deductible, but it will be relatively small, maybe a few $100s, and your annual maximum will also be lower. Compare that to someone with a significantly higher income, their deductible and maximum will be higher too. They'll pay more out of pocket before reaching their limit. When we say net income, we generally mean the figure on line 20 through 600 of your tax return. So it's based on your actual financial picture.
Okay, that makes sense. More help for those who need it most. But you mentioned earlier it's not automatic.
That is absolutely crucial. You must actively enroll in Fair Pharmacare. It doesn't just happen when you turn 65 or sign up for MSP. You need to register. You can do it online, by phone, or using a paper form. You'll need your social insurance number and income details. Taking this step is essential to unlock those subsidies. So many people miss this, or they enroll but forget to update their income if it changes, and they end up paying much more for prescriptions than they need to.
Right, so enroll and keep that income info up to date. Got it. Now, what about the BC Senior Supplement? We've mentioned it before. It's not direct healthcare funding, but it helps indirectly.
It does, yes. The BC Senior Supplement is an extra bit of money for low-income seniors who are already receiving Old Age Security, OAS, and the Guaranteed Income Supplement, GIS, from the federal government. It's a provincial top-up to your income. So while it's not earmarked specifically for healthcare, having that extra bit of income each month can certainly help cover some of those health-related costs that aren't covered by MSP or Fair Pharmacare. Think about things like over-the-counter pain relievers, vitamins, special dietary needs, maybe taxi fare to an appointment. It just gives you a little more flexibility in your overall budget to manage those smaller but still important health expenses.
Okay, so when you put it all together, MSP for the basics, Fair Pharmacare for prescriptions, and maybe the senior supplement for a bit of extra help. These really are the cornerstones for managing healthcare costs in BC.
Absolutely. They form the foundation. Understanding how these programs work, knowing you need to enroll, keeping your info current, doing all that ensures you're getting the maximum benefit you're entitled to as a BC resident. It prevents you from paying out of pocket unnecessarily for things that should be covered or subsidized. It's about using the system smartly.
Okay, so building on that foundation, let's really focus now on mastering prescription costs. Because as we've said, for so many seniors, medications aren't just an occasional thing. They're a significant ongoing part of the monthly budget. Learning how to manage these costs effectively can make a huge difference financially.
You really hit the nail on the head there. Prescriptions are just a reality for so many, and those costs can feel relentless. So this section is all about practical, actionable strategies. What is the absolute number one thing someone should do to save on prescriptions in BC? Thinking back to Mrs. Patel feeling overwhelmed by those costs. The single most critical step, hands down, is to enroll and keep your fair pharmacare information up to date. We can't stress this enough. You have to register. And crucially, if your financial situation changes, maybe you fully retire, maybe your investment income goes up or down, you must update your income information with pharmacare. Why? Because your deductible and your annual maximum payment are directly tied to that net income figure you provide. If you forget to enroll or you neglect to update your income, you could be missing out on substantial subsidies. You might be paying way more than you need to.
Can you elaborate on that? Why is updating so important?
Think of it this way. Pharmacare calculates your benefit based on the income information it has. If that information is old, say, from when you were still working full-time, it might calculate a high deductible for you. But if your income has since dropped significantly in retirement, you might actually qualify for a much lower deductible or even zero deductible. If you don't tell Pharmacare about that income drop, the system doesn't know. You'll keep paying based on your old higher income level. You could literally be paying hundreds, maybe even thousands of dollars more per year than you should be, simply because the system has outdated information. Updating is usually pretty straightforward, often online or a quick phone call. It's worth doing annually, perhaps after you file your taxes.
Wow, okay. That's a really crucial insight. Staying on top of enrollment and updates is clearly non-negotiable. Now, but thinking about the actual medications, what is a simple thing everyone can do right at the pharmacy counter?
Ask for generics. Always ask your doctor when they prescribe something, or your pharmacist when you go to fill it. Is there a generic version available? This is such a simple but powerful way to save money. Generic drugs have the exact same active medicinal ingredients as the brand name drugs. Health Canada ensures they meet the same strict standards for quality, strength, and how they work in your body. They are essentially identical therapeutically. The big difference: cost. Generics are almost always significantly cheaper, sometimes dramatically so. Why? Because the companies making generics didn't have the huge research and development costs the original company did. Asking for a generic means you get the same health benefit, but often at a fraction of the price. For ongoing medications, the savings over a year can be really substantial.
That's great clarification. Same medicine, lower price, definitely worth asking. Okay, sticking with the pharmacy. Does it matter which pharmacy we go to?
You know, it actually can. This is something people often don't think about. Prescription drug prices themselves are often fairly standard, especially after fair pharmacare kicks in. But what can vary quite a bit is the dispensing fee. That's the fee the pharmacy charges for the service of preparing your medication, checking for interactions, counseling you, keeping your records. These fees aren't regulated in the same way drug prices are, so they can differ from pharmacy to pharmacy. Some might charge $5, others might charge $10 or $12 or even more for the exact same prescription.
So it pays to shop around.
It definitely can, especially if you have several regular prescriptions or if your out-of-pocket costs are still significant after pharmacare. It might be worth calling a few different pharmacies in your area or checking their websites to compare the dispensing fees for your specific medications. Even a difference of a few dollars per prescription, multiplied by several medications each month, can add up to real savings over the course of a year. Maybe $100, $200, or more. It's worth a few phone calls.
That's a smart tip. Okay, and related to fees, I've heard about getting a larger supply of medication at once, like a 90-day supply.
Yes, that's another excellent strategy, asking for bulk prescriptions. If it's appropriate for your medication and your doctor agrees, ask for a 90-day supply instead of the standard 30-day supply. The primary benefit here is reducing those dispensing fees. Instead of paying that fee 3 times over 3 months for monthly refills, you pay it only once for a 3-month supply. That directly saves you 2 dispensing fees every 3 months.
Are there any downsides or things to watch out for?
Yes, there's an important caveat. You absolutely must check with your doctor first to make sure a 90-day supply is medically appropriate for you and that specific medication. Some medications might need closer monitoring, especially if they're new to you or if your dose might change. Some might not be stable for that long once dispensed. Also, if it's a new medication, starting with a shorter supply makes sense in case you have side effects and need to stop it. So, always prioritize your doctor's advice on this one. But for stable, long-term medications, it's often a great way to save.
Okay, health first, always. Beyond these pharmacy-level tactics, how important is it to just regularly talk about all your medications with your doctor or pharmacist?
Oh, incredibly important. Proactive management through regular medication reviews is key. It's easy over time to accumulate prescriptions, maybe from different doctors or specialists. Sometimes a condition improves, but a medication doesn't get formally stopped. So make it a point, maybe once a year, to sit down with your doctor or pharmacist and review everything you're taking prescriptions, over-the-counter drugs, even vitamins and supplements. Ask questions like, are all of these still necessary? Could any be interacting badly? Are there potential side effects I should know about? Are there newer, perhaps cheaper or more effective alternatives available now? This process helps eliminate unnecessary costs from drugs you no longer need. It ensures your treatment is optimized. And it opens the door to potentially finding better or more affordable options. Pharmacists often offer specific medication review services too.
That sounds like a really fundamental check-in. Now, what if someone is facing really high costs for a specific drug, even after fair pharmacare? Maybe it's a newer, very specialized medication. Are there any other safety nets, like Mrs. Patel might have wondered about?
That's a tough situation, but yes, there can be other avenues. For very expensive medications, particularly biologics or certain cancer drugs that aren't fully covered by provincial plans, some pharmaceutical companies offer patient assistance programs, PAPs. These programs are designed specifically to help patients afford these high-cost drugs. Depending on the program and your financial situation, they might cover your copay, provide the drug at a significantly reduced cost, or sometimes even provide it for free. This isn't always widely advertised, but it can be a lifeline for people needing these advanced therapies. So the key advice here is, if you're prescribed a very expensive medication, don't hesitate to ask your doctor, your specialist, or your pharmacist if there's a patient assistance program available for that specific drug. They often have information or can direct you to resources, maybe even help with the application process. The manufacturer's website might also have details.
That's really good to know. So it really seems like the overarching theme here is being proactive, asking questions, and taking ownership.
Absolutely. It boils down to this. Think of yourself as being your own financial pharmacist. Every smart question you ask about generics, about fees, about assistance programs, and every informed choice you make, like getting a 90-day supply when appropriate, can lead to significant savings. It ensures your health budget goes further, supporting your well-being without causing undue financial stress. It's about empowerment.
Okay, so we've covered the government plans like MSP and Fair Pharmacare, but as you mentioned, they don't cover everything. Let's talk about extended health benefits. These often cover those crucial things like dental, vision, physiotherapy, massage therapy, services that are really important for quality of life but aren't typically included in the basic provincial plans. These are definitely areas where costs can add up unexpectedly, maybe causing worry for someone like Mrs. Patel trying to budget carefully.
That's a perfect transition. Yes, while MSP handles doctor visits and tests and pharmacare helps with prescriptions, it's these extended services where seniors often face significant out-of-pocket costs. And we're not just talking small amounts sometimes. Major dental work like crowns or bridges can cost thousands. New prescription glasses or hearing aids are significant expenses. Regular physiotherapy after an injury or surgery adds up. And that term paramedical services covers a lot. Chiropractors, registered massage therapists, naturopaths, podiatrists, sometimes even psychologists or dietitians. These services are vital for maintaining mobility, managing pain, and supporting overall well-being as we age.
So where's the first place someone should look if they think they might need coverage for these types of things, especially after they retire?
The very first place to check, and it's often overlooked, is through former employer plans. Many retirees actually continue to have access to extended health benefits through their former employer's pension or retirement benefits package. It might be something you opted into when you retired, or perhaps it's automatic. These plans, carried over from your working years, are often the most comprehensive and offer the best value because they're usually subsidized to some extent by the former employer or negotiated by a union. So the actionable advice is crucial. Dig out your retirement paperwork, contact your former HR department, or reach out to your pension administrator. Don't just assume your benefits stopped when your paychecks did. This could be your best and most affordable source of coverage.
That's a fantastic tip. Check those old connections. What if your spouse or partner is still working or has their own retirement benefits?
Another excellent avenue, spousal coverage. If your spouse or partner is still employed and has a group benefits plan, or if they have their own retiree benefits package, you might be eligible for coverage as a dependent under their plan. Most group plans allow for family coverage. So before you rush out to buy your own private plan, absolutely investigate if you can be added to your spouse's plan. Compare the coverage and the cost. Often, being covered under one family plan is more cost-effective than two separate individual plans. It's definitely worth exploring thoroughly.
Okay, so check former employer, check spouse's plan.
Yeah.
But what if neither of those is an option? What's next?
Right. If you don't have access to group coverage through those routes, then you'll need to look into purchasing private extended health insurance. This is where you really need to do your homework because there's a wide variety of plans out there offered by different insurance companies. You need to research these plans carefully. Pay close attention to a few key things. First, the deductibles. How much do you have to pay yourself before the insurance starts paying? Higher deductible usually means lower monthly premium, but more cost up front if you need care. Second, the copays or coinsurance. Even after the deductible, you might still pay a percentage of the cost, like 20% for dental work. Understand what your share is. And third, crucially, what's actually covered. Does the plan include major dental? Does it cover hearing aids? What are the maximum amounts they'll pay per year for things like massage or physiotherapy? You really need to match the plan's coverage to your likely needs.
And are there specific companies people should look at in BC?
Yes, there are several well-known providers offering plans specifically for seniors or individuals in BC. Companies like Pacific Blue Cross, Sun Life, Manulife, GMS, or CAA are common ones. It's wise to get quotes from several different providers and compare the details of their plans side by side. Read the fine print, especially regarding limitations or exclusions for pre-existing conditions. Although many plans for seniors are designed to accept applicants regardless of health status, sometimes with waiting periods for certain benefits.
Good to have those names. Are there any other, maybe less common ways to get some benefits?
A couple of other possibilities exist. If you belong to a specific union or professional association, check if they offer retiree health plans. Sometimes these are quite good. Also, some premium credit cards offer certain benefits, most often emergency travel medical insurance. This isn't a replacement for regular extended health coverage for day-to-day needs in BC, but it can be a valuable perk if you travel. But, and this is important, you must read the policy details very carefully. These travel plans often have strict age limits, trip duration limits, and rules about pre-existing conditions. Don't just assume you're covered, understand the limitations.
That's a lot to consider when choosing a private plan. So what's the key takeaway, the LLL SMART tip for making the right choice?
The LL SMART tip here is all about personalization and strategic thinking. Don't just look at the monthly premium. You need to compare your actual needs and likely usage with what different plans offer. Ask yourself, what services do I realistically expect to use? If you have excellent teeth, rarely need glasses, and are generally very healthy, maybe a basic plan with a higher deductible but lower premium makes sense. You're saving money month to month. But if you know you have significant ongoing dental needs or you rely on regular physiotherapy, then paying a higher premium for a more comprehensive plan with lower deductibles and better coverage maximums might actually save you money in the long run because your out-of-pocket costs for those services will be much lower. It's about doing a personal cost-benefit analysis based on your health history and anticipated future needs. It's not one size fits all.
That really drives home the point. It's about finding the right fit for your specific situation, not just the cheapest or the fanciest plan available. Personalization is definitely key to smart spending here.
Okay, now we need to shift gears a bit into an area that can feel sensitive, but is absolutely essential for smart long-term planning. That's navigating the costs associated with home care and long-term care. Thinking about needing more help as we age might not be comfortable, but planning for these potential future care needs before a crisis hits can relieve a huge amount of financial stress and emotional turmoil later on. It's about foresight.
You're so right. It's really an investment in peace of mind, not just for us, but for our families too. Let's start with home care. Many seniors, perhaps like Mrs. Patel, really want to stay in their own homes if possible. How does that work in BC, cost-wise?
That's definitely the preference for most people aging in place. And BC does have publicly funded home health services to support this. These services are accessed through your regional health authority, like Vancouver Coastal, Fraser Health, etc. You typically start with a needs assessment by one of their case managers or healthcare professionals. Based on that assessment, you might qualify for services like nursing care at home, physiotherapy, or occupational therapy, and some help with personal care, things like bathing, dressing, maybe medication reminders.
So there is public support available, but are there limits?
Yes, and that's the critical piece to understand. While public funding exists, the amount of service, particularly for personal care, might be limited based on your assessed need and available resources. For example, the assessment might determine you need help with bathing twice a week, and that's what the public system will provide. But what if you feel you need help getting dressed every day or assistance with meals? Those extra hours might not be covered. This is where private home care comes in. You can hire private agencies or individuals to provide additional support. But, and this is a big but, private home care can be very expensive. Costs can easily run from $30 to $60 an hour or even more. If you need several hours of care per day, that can quickly add up to thousands of dollars per month, a significant financial burden that requires careful budgeting.
Okay, so even with public help, private care might be necessary, and it's costly. How can people plan for that smartly? Maybe find ways to reduce those costs.
Smart planning for home care really involves looking at a mix of supports. First, definitely explore family support. Can family members help with certain tasks, like groceries, driving, or checking in? Second, look into local nonprofits. Many communities have organizations offering volunteer drivers, meal delivery services, friendly visiting programs, or subsidized housekeeping, which can supplement formal care and reduce costs. Your local senior center or the Senior Services Society of BC can be good places to find these. Third, if you anticipate needing significant private care, start budgeting for it now. Set aside savings specifically for this purpose. And fourth, for homeowners, there's the option of using home equity, perhaps through a reverse mortgage or a home equity line of credit, HELOC. This can provide funds for care while allowing you to stay home. But, and I really need to emphasize this, these are complex financial decisions with long-term consequences. Using home equity can impact your estate and future choices. It is absolutely essential to get independent, professional financial advice before going down this path. Understand all the implications.
That's really critical advice about the financial consultation. Okay, what about moving out of the home? What's the next level of care, like assisted living?
Right. Assisted living can be a good middle ground. It offers more support than independent living, but less than full long-term care. Typically, you get your own private apartment or suite, so you maintain independence. But the facility provides services like meals, often in a common dining room, housekeeping, laundry, social activities, and crucially, personal care assistance as needed help with bathing, dressing, medications. Costs for assisted living vary hugely depending on location, services, and suite size. Generally, it's paid for privately, and monthly fees can range from, say, $2,500 up to $7,000 or even more. It's a significant expense.
Is there any public funding for assisted living?
Yes, there is, but it's limited. Some assisted living spaces in BC are subsidized through the health authorities. Access to these subsidized spots is based on both your assessed care needs and your income. You have to go through the same health authority assessment process as for home care. If you qualify based on need and income, you pay a monthly rate based on your income, similar to long-term care, usually around 70% of your after-tax income, and the health authority subsidizes the rest. But wait lists for subsidized spots can be long.
Okay. And then for people with the most complex needs, there's long-term care or residential care. How does that work, especially financially?
Long-term care, or residential care, provides 24-hour nursing supervision and personal care. It's for individuals with complex health needs that can no longer be managed safely at home or in assisted living. The cost structure in BC is quite specific. You, the resident, pay a daily client rate. This rate is income tested, meaning it's calculated based on your after-tax income from all sources, OAS, GIS, pensions, etc. The key thing is that this rate is calculated to cover a large portion of your income currently. It's set at 80% of your after-tax income, up to a maximum monthly amount set by the province, which changes periodically, but it's currently over $3,900 per month. So you pay based on your ability to pay, up to that maximum. This leaves you with a smaller amount for personal expenses each month. The province, through the health authority, covers the actual healthcare costs within the facility, nursing, therapies, medical supplies associated with your care. It's substantial personal contribution for most people, which is why planning is so important.
That 80% figure really highlights the impact. So how do you plan smartly for that potential cost?
Smart planning for potential long-term care involves a few key things. First, be informed. Go to your health authority's website and look up the current client rates. Understand how they're calculated. Transparency helps you plan. Second, consider long-term care insurance. This is a specific type of insurance designed to help cover the costs of care if you need it later in life. But the critical factor with this insurance is timing. You generally need to buy it much earlier in life, often in your 40s or 50s, when you're healthier. Premiums increase significantly with age, and it can become unaffordable or unavailable if you wait too long or develop health issues. It's designed to protect your savings and assets. Third, if insurance isn't an option or doesn't cover everything, ensure you have adequate personal savings earmarked for potential future care costs. This might mean adjusting your retirement savings goals or investment strategy.
It really sounds like having a plan, even a basic one, can make a huge difference when it comes to these future care needs.
It's the absolute core wisdom here. Planning for future care is like building a bridge to your secure future. It's about proactive preparation, thinking through the what ifs, rather than being forced to react in the middle of a stressful health crisis. Having a plan, even if it needs adjusting later, brings immense peace of mind. It empowers you and eases the potential burden on your family.
That peace of mind is truly priceless. Knowing you've considered these possibilities makes a world of difference. Okay, so we've covered the main provincial plans, extended benefits, and planning for future care like home care and long-term care. Huge topics. But beyond those major areas, are there other specific financial assistance programs or resources seniors in BC should know about? Sometimes it's the smaller programs that can make a real difference, filling in the gaps.
That's a great point. The system is complex, and beyond the big programs, there are definitely other pockets of support and valuable resources that can help. Navigating it all can feel like a puzzle, so knowing about these extra pieces is important.
What's one example of a specific provincial benefit for a particular situation?
A really important one, especially for families dealing with end-of-life care, is the BC Palliative Care Benefits Program. This program helps cover the costs of certain medical supplies, equipment like hospital beds or oxygen, and some prescription drugs specifically needed for palliative care being received at home or in a hospice that doesn't charge a fee. It's designed to ease the financial burden during a very difficult time and support the choice to receive care outside of a hospital setting, if that's preferred. Eligibility is based on a palliative diagnosis confirmed by a doctor or nurse practitioner.
That sounds incredibly helpful for families in that situation.
Yeah.
Now, shifting to the federal level, what about help through the tax system? We pay taxes. Can we get some relief back for health costs?
Absolutely. Leveraging the tax system is often overlooked, but can provide significant financial relief. There are two main federal tax credits to be aware of. First is the Disability Tax Credit, DTC. If you have a severe and prolonged physical or mental impairment that significantly restricts your basic activities of daily living, you might qualify. Getting approved for the DTC involves your doctor filling out a specific form, T2201. But if approved, it provides a non-refundable tax credit that can substantially reduce the amount of income tax you owe. This doesn't just reduce your tax bill, it can also open the door to other related benefits, like the Registered Disability Savings Plan, RDSP. It can free up hundreds, even thousands of dollars annually that can then be used for healthcare or other needs. Many who might qualify don't apply because they think it's too difficult or don't realize they meet the criteria.
Okay, so the DTC is for significant impairments. What about more general medical costs that many seniors face?
That's where the Medical Expense Tax Credit, METC, comes in. This is relevant for almost everyone who has out-of-pocket medical costs. The key here is keep all your receipts. Track every dollar you spend on eligible medical expenses not covered by insurance or government plans. This includes things like your share of prescription costs, dental fees, vision care, glasses, contacts, eye exams, physiotherapy, massage therapy, hearing aids, walkers, premiums paid for private health plans, travel costs if you had to travel more than 40 kilometers for medical treatment. The list is quite long. You can claim a federal tax credit for eligible expenses that exceed a certain threshold, which is calculated based on your net income, currently 3% of net income or a set dollar amount, whichever is lower. Even seemingly small expenses, when added up over the year, can surpass that threshold and result in a valuable tax credit, reducing the taxes you pay. Many people miss out simply because they don't track these expenses diligently.
That's a great reminder. Keep those receipts organized. Now, beyond government programs and taxes, what about support right in our local communities?
Local resources are vital. Start with your regional health authority website, Island Health, Fraser Health, etc. They have dedicated sections, often under seniors or home and community care, with information on local clinics, support groups, home care options, mental health services, and specific programs available in your geographic area. They are the gateway to publicly funded services. Also, don't underestimate nonprofit organizations. Groups focused on specific conditions like the Alzheimer's Society, Heart and Stroke, Diabetes Canada, Arthritis Society, or cancer support groups often provide invaluable information, support programs, peer connections, and sometimes even direct financial assistance or equipment loan programs related to that condition. They fill crucial gaps. And for general guidance, the Senior Services Society of BC is an excellent province-wide resource. They offer advocacy, information, and referral services, helping seniors connect with the health-related resources and supports they need. They can be a great starting point if you're feeling overwhelmed and unsure where to turn.
That's a fantastic network of potential support. It really seems like there's help out there if you know where to look and who to ask.
Which brings us to the essential LLL Smart tip for this section. Don't be afraid to ask for help. Seriously, navigating healthcare and financial assistance programs can be complicated. No one expects you to know it all. Reach out. Talk to social workers and hospitals. They're experts in connecting patients with community resources. Contact patient advocates. Call the information lines for the health authorities or organizations like the Senior Services Society. Asking for guidance isn't a sign of weakness. It's a sign of wisdom. It's about being proactive in accessing the support you're entitled to, ensuring you get the help you need to manage your health and finances effectively. And that brings us to our final section. We've talked a lot about managing costs once they arise, but arguably the most effective way to save on healthcare costs, especially in the long run, is to invest in your health right now.
The ultimate long-term strategy. Makes perfect sense. Prevention is better than cure, not just for our well-being, but also for our wallets. This feels like something Mrs. Patel would appreciate, focusing on staying healthy to minimize future worries. So what are the key things we can do?
The pillars of the strategy are things we often hear about, but their financial impact is truly profound. First, a balanced diet. Eating well fuels your body, maintains a healthy weight, and reduces the risk of chronic diseases like type 2 diabetes and heart disease, which are very costly to manage. Second, regular exercise. Staying active keeps your body strong, improves balance, reducing fall risk, boosts cardiovascular health, and helps manage conditions like arthritis. Even gentle activities like walking make a difference. Third, adequate sleep. Good sleep is crucial for recovery, immune function, and cognitive health. Lack of sleep is linked to numerous health problems. And fourth, stress management. Chronic stress takes a toll physically and mentally. Finding healthy ways to cope, whether it's hobbies, mindfulness, spending time in nature, or social connection, can prevent stress-related health issues. Taken together, these lifestyle choices significantly reduce your risk of developing or worsening the very chronic conditions that drive the majority of healthcare spending later in life.
Simple concepts, but powerful results. What about the role of formal preventative care, like checkups and screenings?
Absolutely critical. Preventative care is about catching potential problems early when they're usually much easier and cheaper to treat. So don't skip your regular checkups with your doctor, even if you feel fine. Get your recommended vaccinations, flu shots, shingles, pneumonia. Follow through on recommended screenings based on your age and risk factors. Mammograms, colonoscopies, bone density scans, blood pressure checks, cholesterol tests, and don't forget regular dental checkups and cleanings. Finding a small cavity early is far less expensive and invasive than needing a root canal or implant later. Early detection saves money and improves outcomes.
Makes perfect sense. And if you already have a chronic condition,
Then diligent management is key. If you have something like diabetes, high blood pressure, heart disease, or COPD, strictly follow your doctor's advice. Take your medications as prescribed. Monitor your condition as recommended, blood sugar, blood pressure. Attend follow-up appointments. Make the necessary lifestyle changes. Good management prevents minor issues from becoming major complications, things like hospitalizations, emergency visits, kidney failure, heart attacks, strokes, all of which are incredibly expensive and life-altering. Consistent effort now avoids massive costs later.
right. And what about habits like smoking or excessive drinking? Their impact must be significant too.
Hugely significant, both for health and finances. Quitting smoking is probably the single best thing someone can do for their long-term health and wallet. Smoking causes or worsens so many expensive diseases. Similarly, reducing excessive alcohol consumption lowers the risk of liver disease, certain cancers, heart problems, and accidents. Addressing these habits directly cuts down future healthcare needs and costs dramatically. There are resources available, like BC's Quit Now program, to help.
And we shouldn't forget the mental and social side of health either, right? We've
Right.
talked about connection before.
Exactly. Staying socially engaged is vital. Loneliness and isolation are actually risk factors for poor health outcomes, including depression, cognitive decline, and even heart disease. Maintaining social connections, participating in activities, volunteering, these things support mental well-being, which is intrinsically linked to physical health. A holistic approach is key. Being connected helps keep you resilient.
So when you put it all together, This proactive approach to health really is the foundation for financial well-being, too.
It truly is. The ultimate LLL smart advice here is this. Your health is your greatest wealth. Investing your time and effort into staying healthy today through diet, exercise, preventative care, managing conditions, ditching harmful habits, and staying connected is fundamentally the best long-term financial plan you can make for managing your healthcare costs tomorrow. It's the investment that pays the biggest dividends in quality of life and financial security.
That's a powerful and positive note to end the main part of our discussion on. Investing in ourselves pays off in so many ways. Well, there you have it, our lively later life community. That was quite the deep dive into smart planning for healthcare costs here in BC. Our aim today was really to empower you, to help you navigate the system more confidently and save more, ensuring you have that secure and healthy retirement you deserve. We covered a lot of ground. We certainly did. From understanding those core programs like MSP and Fair Pharmacare to strategies for mastering prescription costs, getting a handle on extended benefits, planning ahead for future care needs, and knowing about the various financial assistance programs out there. Remember, every single informed decision you make really does strengthen both your health and your financial peace of mind.
Absolutely. Your well-being is just paramount. And by being proactive, by staying informed, you can make sure your healthcare needs are met without adding unnecessary financial stress. And that frees you up to truly live that vibrant, fulfilling later life. If you found this deep dive helpful, if it gave you a bit more confidence in managing healthcare costs, please do give us a thumbs up. And definitely make sure you subscribe to the Lively Later Life channel and hit that notification bell. That way, you won't miss out on upcoming episodes in our Smart Spending series or any of the other valuable conversations we have planned just for you.
And please, keep the conversation going. We genuinely want to hear from you. Is there a question about healthcare costs still lingering in your mind? Or maybe you have a success story, a smart tip about saving money on health expenses that worked for you. Share it in the comments below. Your insights, your experiences, they can really help illuminate the path for others in our lively later life family.
Until next time, remember to plan smart, stay healthy, and keep embracing your lively later life to the absolute fullest.